Welcome to the Rehab Roundup. I am your host, board certified physiatrist and independent practice owner, Dr. Hassan. I help physiatrists start and grow profitable practices so that they can achieve financial independence and live without limits. Welcome back to the Rehab Roundup. Today, I want to talk to you about Medicare versus Medicare Advantage. A lot of times when I'm seeing my patients, I hear them say, "Hey doc, I have great insurance." Little do they know, there's a huge difference when it comes to straight Medicare products versus Medicare Advantage products. So in terms of Medicare Advantage, what that is Medicare has outsourced the management of that Medicare benefit to a commercial insurance plan. So what that means is it's very different from straight Medicare in that any access to acute rehab services has to be pre-approved. So when you're talking about a straight Medicare product, it's very streamlined. It's a very easy process in terms of gaining access to acute rehab level of care. Whereas with the Medicare Advantage programs, it's quite different, could be cumbersome, and sometimes it can take up to 72 hours to get that authorization to transition that patient to acute rehab. As an added layer, these Medicare Advantage programs sometimes use certain criteria that is outside of that set forth by Medicare to determine whether or not a patient is appropriate for acute rehab level of care. So when that patient says to me, "Hey doc, I have great insurance, there shouldn't be any problem," I think that is a lack of knowledge of what they actually have. So that makes it very important that us, from a physiatry standpoint, are out there seeing patients, educating folks, educating the case managers, everybody in the acute care hospital, or whatever setting you're in, seeing these patients to show them the differences between straight Medicare and Medicare Advantage. Again, there's a huge difference between straight Medicare and Medicare Advantage when you're talking about access to acute rehab and access in general. So it's going to be very important to educate the patients, the healthcare providers about that difference. And when you do have that Advantage plan, you definitely have to go out there, advocate, and push and try and get that patient to the right level of care. So again, Medicare versus Medicare Advantage. With a Medicare plan, it's very easy and streamlined to get access to acute rehab level care, whereas with the Medicare Advantage plan, there are multiple layers that the patient has to get through before they kind of get that access. I am your host of the Rehab Roundup, Dr. Hassan, board certified physiatrist, independent practice owner, helping physiatrists start and grow profitable practices so that they can achieve financial independence and live without limits. Join me next week, again Monday at 9 p.m. We'll be discussing another topic. Thank you again. You can follow me at Dr. Hassan Rehab, DrHassan Rehab, on Facebook and all other social media platforms. Thank you. Have a good night.